Hi, I'm Gwen Krieger. I'm the nutritionist at Heart of Wellness, and February is Heart Health Month, so I'm here to interview David Lerner. He's an acupuncturist and herbalist with training in functional medicine, which he utilizes in conjunction with the doctors at the clinic. And we also have Tim Shannon here. He's a naturopath at our clinic who specializes in homeopathy, and we're going to discuss how we approach heart disease and prevention of heart disease at the clinic. If I go to my normal allopathic doctor and I get the typical blood panel for assessing heart risk, heart disease risk, they're going to do just my LDL and my triglycerides, HDL, total cholesterol, which might look great, but I could still be at serious risk of heart disease.
Absolutely.
And here, we go further and test those other markers that have great scientific backing, better predictors of whether you have on the road to heart disease or not.
Yeah, and I just want to add, it's not just the LDL and the cholesterol that are the big players in terms of someone having a plaque in their arteries and a plaque that ruptures. Right. But there's other more important issues to some degree, which is how much inflammation is in the area, how much oxidation is in the area. So LDL by itself isn't necessarily a bad thing. LDL is necessary for life. The concept that cholesterol, that LDL is evil, isn't really true. But if LDL is small and dense, if LDL becomes oxidized, if LDL burrows into the arterial wall, then you create, you're setting yourself up for getting a plaque, and a plaque that potentially can rupture, and that can cause an incident, myocardial infarction or heart attack.
Okay.
And what people don't realize is that cholesterol is something that your liver manufactures, and it's the substrate, i.e. the beginning material that your body then develops hormones from. And if you drop your cholesterol too low, which happens all the time. I mean, so many patients who are on statins, they come in and their doctor says, wow, your cholesterol is so low. And I look at it and I'm like, well, what are you going to make your steroid hormones from? And when I run their hormones, I can see that they're all low. So it's not so simple as just change one number. It has many more effects.
And I agree with that, because what I like when we talk about even looking at our bodies functionally is one system, your cardiovascular system, is not separate from your other systems. So when you're affecting your cardiovascular, it's going to affect your digestion, it's going to affect your endocrine system. They all interact together to make up the whole. And that's why I appreciate that we look at those things. Okay, now the other question I asked that I'd like you to answer is, what causes triglycerides to elevate? Yeah,
good question. So triglycerides are an indication of fat in the blood. So oftentimes people think, well, let's cut fat out of the diet and that'll lower it. But what we find is actually cutting down sugar and starch is a much better way of lowering triglycerides than actually focusing on fats. So this sets into motion the questions of diets. And again, you know, if triglycerides are producing small, dense LDL, which are the most problematic type of LDL, what sort of diet's going to best control that is going to be more of a low starch, low sugar, what we call a low glycemic diet, even more than a low fat diet.
And that's where, you know, me as the nutritionist working with the doctors, it's a really wonderful balance, because we're all on the same page. Doctors are looking at labs and the results of very accurate tests, and then we can collaboratively find the best lifestyle changes appropriate to help somebody prevent heart disease, reverse heart disease. And so when you come to Heart of Wellness, you're getting lifestyle medicine. You are going to get great tests, very knowledgeable doctors, other modalities that will help manage stress, and then you get to work with myself and the doctors, where we're going to help you see what is the best form of exercise for you, what is the best diet for you, and you'll get really good results that are measurable.
Yeah.
So you get to see the results.
We really try to customize care. There's no one-size-fits-all that we'll do here.
So thank you. I hope this interview was informative, and I hope it gave you some takeaways that you can think about, and please, we would love to see you. We give 15-minute free consults, so you can call our office at 360-570-0401, or you can go to our website at heartofwellness.org and read the bios on all the practitioners here, and come check us out. Thanks for tuning in.